Hey, so today's lecture is a little shorter. It's on solution-focused therapy, and it's shorter because it's a very brief theory, um, but also I usually teach this theory. It's a contemporary theory. I usually teach it the same night that we have an exam, and this is an exam night as well, but instead of taking that exam in class, you'll be taking it at home. And, uh, and that is why we normally have a shorter lecture. We also have a student presentation that you can watch. So solution-focused therapy, that was originated by DeShazer and Insoo Kim. It is a fairly recent therapy and theory. And I'd like to give my personal reaction to this theory first. Um, it's a very popular theory. It follows in the footsteps of cognitive behavioral theory or cognitive uh, theory, CT or CBT, and REBT, rational emotive behavior therapy. Um, I would say it is extremely brief. Um, so the positives of it, it can be used in schools very easily. Um, it was originally created for individual therapy, and then my professor and a colleague, um, and uh, so Rebecca LaFountain was my professor when I was in a master's degree, and we conducted a study using this theory, but the theory was brand new at the time we began using it, and we were one of the very first articles, if not the first, to apply this theory to group counseling, especially in a school setting. So we had a pretty extensive study. We got some statistically relevant results, and and I think it helped quite a few students. We trained school counselors to use this theory, and and it was a very positive experience. Um, most journals that followed this publication uh, referenced us and cited our work. So it was a very positive experience for me as a student. Um, I think that uh, there are some very positive aspects of this theory. One of the, I guess, criticisms that I would have of this theory is that even though it works very well with not only situational problems that are causing some anxiety, stress, uh, emotional issues, um, and it may work with some minor issues. I don't think it is a theory that does well with deeper issues, issues that could be a result of trauma, abuse, searches for meaning, fulfillment, um, things like that. I don't think it does well with some of the more severe DSM diagnoses. Uh, it can help with coping skills. Um, so I would say that it's a good general brief theory that works good with self-awareness and everyday life issues. I would not recommend it for more serious issues, but it can be combined with other theories, and that combination of this brief I would call it a cognitive theory. I think it's in that realm. Uh, I think in combination with other theories that deal with more serious issues, it could be a nice combination because everybody deals with everyday issues as well as some deeper issues. So uh, let's talk about the theory and some of the things that are stressed first are that um, it focuses on solutions, hence the name, and solution focused. And it doesn't focus on negative things, like it doesn't focus on complaining or uh, things like that. And that's very, very similar to Glasser's theory, choice theory, and reality therapy. Also, cognitive theories, CT and REBT. These all have a lot in common. The other thing is that people need to be screened not only for group solution focused therapy, but even individual solution focused therapy. They're screened for a number of things. First of all, uh, they have to have the cognitive ability to uh, deal with, I would say, not really complex concepts, but uh, some higher functioning cognitive ability uh, to move through the concepts of this theory, which they must also learn. So they do have to have that ability, that to understand the theory itself, which we teach them. The other thing they are screened for is that they need to want to change. They need to have the motivation to solve their problem and to work towards that. So their goals would be to overcome some obstacle in their life, some problem in their life. So once once the client begins individual or group therapy, individual therapy, of course, they work one-on-one with the therapist, but group therapy, I feel, works really well because um, they can interact to find solutions with other group members. So other group members can help them to find solutions to their issues. And we'll talk about some of the skills and techniques that they use in order to do that. The first sessions, we begin to work on their language. And I do have to say that I do not have the typical notes for this week. I simply gave you a PDF version of the article that we published, and it not only, its introduction is uh, teaching you the basics of this theory, and then it talks about how we applied it to group counseling, talks about our study, uh, and then it goes into what we did each week in that group, and then it has a concluding discussion of the results. So if you read that one journal article, uh, it's almost like reading a chapter in a book on solution-focused therapy. I will also say that even though it was applied in a school system, that you can use the same exact techniques and methodology for individual counseling and to clinical mental health as well as schools. So there's really very little difference. Um, okay, so the first sessions, we begin to work on the language aspect, just as Glasser or Ellis or even Beck would help clients to change their language from passive to active. And so that means uh, not acting as if something is happening to them, like an issue or an emotion or a problem, but taking ownership of that and using language that represents that. Then we begin by setting goals and long term and short term. But by long term, because it's brief therapy, we're talking about 8 weeks maybe. And short term, we're talking about 1 week. What are we going to do before the next session? So short term and long term goals are uh, much more condensed in brief therapy. And if they need help setting those goals, we can help them, but we want them to take ownership of those goals. Um, they share both the issue, problem, emotion, and goals in the first sessions, and they are encouraged and supported um, throughout. So we also have them do homework, take steps uh, to make personal improvements each week. We have them share success or failures in that, and we talk about if it was a failure, they weren't able to succeed in their weekly homework or goal, how to improve that and maybe try something a little differently. If they were successful, how can we continue the success and uh, take some more steps to grow towards their larger goal? The two primary techniques for solution focused therapy, the first one is the miracle question. It has to be, we do have some guidelines. It can't be something, even though it's called the miracle question, uh, the miracle has to be something that can actually occur. And we hope that it is something that we can make occur. So the miracle question is basically we ask the client, if you went to sleep tonight and a miracle occurred and your problem was solved, how would you know when you woke up that your problem was solved? What would be different? What would be different in your environment, your situation, your family, yourself? And hopefully, as we begin to examine those areas of change and differences, we can talk further about what is within the client's control and how they can make those changes actually occur. So they can't say, well, I woke up and I had $1 million, something like that. You know, the change has to be realistic. So um, if they were experiencing issues that were beyond their control, like maybe their parents were separating, um, well, the solution would not be, the miracle would not be that they were back together again. The miracle would be that they no longer had those feelings of loss and anxiety and abandonment that they might be experiencing. So, dealing with those emotions can be within their control. So, there's a little bit of difference, and we have to help the client with this technique a little bit, especially if they are young. So we're moving along that process of understanding what our choices are, what is within our control, what is not within our control, understanding that we do have control over certain things. And even though we might not be able to change the larger situation that results from other people's choices and actions, we can change the way we react to them and how we move forward in our own lives. The second technique is called skeleton keys. And if you've ever seen a skeleton key, it's one key that can open every door in a house. That's why they call it a skeleton key. Um, so one key opens a lot of locks. It gets you past a lot of obstacles. So think about it this way. Maybe somebody, a client, uh, had a previous problem and they were able to overcome that problem, that issue. Maybe they felt a similar emotion or they had a similar obstacle and they found something that helped them overcome it or get to a more positive feeling. So they could take the key that opened that previous lock, that door, that obstacle, and perhaps apply something similar to the current situation. It's even better in a group setting because perhaps somebody else had a similar issue and they found a key that helped them to overcome that obstacle. They could share their skeleton key with somebody else in the group, and the other client could try it. Now, I think my only criticism of this would be that it leans towards problem solving. Um, and I like dealing with the underlying issue, if there is one, because my personal theory is that if you don't deal with the underlying issue, if you only deal with the surface issue, the symptom of a deeper issue, and you do away with the symptom, yes, that symptom will go away for a little while, but it will resurface at a later time if that deeper issue is not resolved. So, problem solving tends to deal with symptoms and surface issues, usually not deeper issues. And that goes back to my earlier criticism of the theory as a whole, that it usually deals with more surface issues or lighter issues or less severe issues. I guess that's the best term, less severe issues. So as long as there's not a deeper underlying issue, I don't have a problem with using this theory or these techniques. Um, However, if there is an underlying issue, it is not a permanent resolution. Then each week, we try these things in between the sessions. We evaluate how they went. We either try new things or we make changes, and we set new goals for the next week. We evaluate our process, our progress, and hopefully within 6 to 8 weeks, um, people are doing much better. So it's a very simple theory. It's very popular because it gives a structure to counselors, and counselors tend to like structure. They like steps. What do I do this week with the client? And and clients tend to like this as well. It tends to do away with a lot of anxiety, producing thoughts. It usually doesn't get too deep, and people find some resolutions to their day-to-day issues, things that every human being usually deals with. Okay, so please read the journal article that I posted on D2L, and we will discuss it at the beginning of class next week, and I will answer any questions that you have. Thanks.